We became really the first and only company in the industry to use the data to build better all-in-one products that are more customized for the individual, that deliver that simplicity and format of a single pill at a cost point that is acceptable to the consumers.
Crazy.
Brad Helfand, CEO of Vous Vitamin. Thanks for joining me today.
Glad to be with you, Logan.
As our audience knows, we typically cover, the show is all about health tech and health innovation, and you run a company called Vous Vitamin. And so if a first question somebody might ask is, what's a story about vitamins doing on a show about tech and innovation, which I know you have a good answer for, but why don't you just start by laying out what the company is and why it falls into the category of this show?
Well, Logan, Vous Vitamin is a personalized vitamin company. We actually use technology and digital health to customize vitamin routines. And the company itself was founded by two doctors in the Chicago area, one an endocrinologist, the other internal medicine doctor, that were seeing so many patients coming into their practices confused about vitamins and supplements, baggies of pills saying, "Doc, does any of this stuff work?" And when they went into the mass market to look at what products were in the vitamin aisles, they were disappointed to find there were a lot of unsafe products, a lot of products that were built for the lowest common denominator, those A to Z multivitamins for all men and all women and all seniors. They just didn't have the right dosing or composition to make a difference based on people's individual needs. And so, Logan, in 2013, they founded Vous Vitamin, launched in 2014. And the idea is we take in a data-based assessment and use that data to customize an all-in-one multivitamin, thinking about what nutrients are most critical for that individual on a daily basis and how to dose those effectively for individualized needs.
Now, when I think of vitamins, I think about those shelves at the CVS, just rows and rows, and I have kind of no idea what I'm looking for. So that speaks to me in terms of like giving me the information I need. My next question is about this personalized vitamin category. I saw that you were named like best, what was it? Most convenient, or you were on a best of list for personalized vitamin subscriptions. Is that right?
That's right. We were really pleased, Logan. In 2025 already, CNET has come out with their list of best vitamin subscriptions, and we were named one of the top 5 in the country. And that follows a slew of media recognition we've collected over the years from diverse publications like Prevention Magazine, Women's Health, Better Nutrition, Healthline, and Medical News Today, among others, that have called us one of the best out there.
So the question I had when I saw it was a list of best personalized vitamin subscriptions, I was like, oh, this market must be bigger than I realized, because when I think about vitamins, my uneducated view is that rack. I don't necessarily think about personalized subscriptions. So tell us about the larger market. Is it competitive? What other types of companies are doing personalized vitamin subscriptions?
We're really in the first wave of this emerging sector of vitamins. It's a very small piece of the overall industry right now, but growing incredibly quickly. And the first generation of companies like us, which again, we entered the market in 2014, companies like ours generally did pill packs. And so they were supply chain innovations. They took a lot of different mass market vitamins, like letter vitamins, and collated them in a baggie with your name on it for you to take every day. But oftentimes consumers were taking 8, 9, 10 plus vitamins every day of different shapes and sizes, spending over $100 a month, even over $200 a month for their personalized vitamin pack. Our doctors who founded Vous Vitamin always thought that model was not sustainable for the average consumer that needs long-term adherence on a vitamin routine. So we became really the first and only company in the industry to use the data to build better all-in-one products that are more customized for the individual, that deliver that simplicity and format of a single pill at a cost point that is acceptable to the consumer. So we're $1 a day offering, sometimes much less than that with discounts and coupons, but we're very affordable for the average consumer to take their step out of the mass market into the personalized side of the industry.
And who do you see as your current target, and where are you hoping to grow in terms of who'd use this service? I think we've got our current understanding of the kind of folks who would want to go to the vitamin aisle, and there's probably where you would like to take that.
Yeah, our current consumer is really a direct-to-consumer who is confused about vitamins and supplements. They're lost in those vitamin aisles. Much like myself, when I first learned about the company, I reflected on my own journey, and I was someone who walked into a large retail pharmacy and didn't know what I was doing in those aisles. And so the majority of our consumers today have come to us through a direct-to-consumer outreach effort, digital advertising, and so forth. In the future, and we're already seeing this reflected in our own numbers, we're going to have a much bigger portion of the business be B2B strategic channel partners. And one of the B2B channel plays that we've been very successful with, in fact, there was a recent article about our program, is we built the very first vitamin benefit program for the corporate workplace. So if you think about vitamins and employer health benefits, vitamins are excluded from commercial health insurance. You can't get your vitamins covered by your insurance card. And surprising to most consumers, vitamins are highly restricted under FSA and HSA accounts because of IRS definitions, that those accounts can only cover condition-specific items. They can't cover general health items. So you can't get your toothbrush and toothpaste reimbursed by your FSA or HSA. You also can't get a multivitamin or a daily vitamin reimbursed by your FSA, HSA without a letter of medical necessity, which is very rare in the industry to have.
Are those attitudes changing as I hope and I sort of sense that people are understanding the importance of preventative health more and more?
I think we're trying to capture that mind share. I don't think attitudes are changing quickly enough. So I think there is a lack of perception about what's evidence-based in prevention and corporate well-being and what should be part of a program. Oftentimes, vitamins are a forgotten category. So employers a lot of times have invested heavily in prescription drugs. So they have a PBM that's educating their members about what drugs to select, how to select generics over brand name drugs in certain cases. And then they've got a lot of education on the food and nutrition side, so weight loss and healthy eating and healthy dieting. But what's the cousin to food and prescription drugs? Well, vitamins and supplements. And what resources do employers have today on vitamins and supplements? Really, most employers have very little or nothing in that category. And that's where we're solving that with our program, which delivers best-in-class education, that's physician-developed education on vitamin selection, digital tools that help with navigation, group savings, and even reimbursement in some case to give people out-of-pocket cost savings and cost relief, at-home delivery to get personalized nutrition into the home, and well-being analytics to measure the impact of a vitamin on health. So how is someone doing in terms of their adherence and health outcomes over time?
Tell me more about that education and the storytelling piece as you try to really bring providers on board, bring consumers on board, help them understand the importance of vitamins. I mean, what are you doing to try to break through? Because you are dealing with decades of misunderstanding, even stigma.
Yeah, education has really been the tip of the spear for us in terms of promoting this program and getting traction in the marketplace, because most vitamin companies are product first, and we tend to be education first. So our board certified physicians have written over 100 articles on different vitamin topics, from vitamins and mood disorders like anxiety and depression, to vitamins and energy levels, to chronic conditions like diabetes or cancer or heart disease. So we've got a great educational content library. I should also mention the doctors behind our company wrote the award-winning book in the space. So they wrote a book called The Vitamin Solution that won 7 national awards, really seen as one of the seminal books. And they do very frequently webinars or educational programs that are live or taped where they share their knowledge on vitamins. So I think that education piece is very important. I think a lot of employers are worried about working with a vitamin company because they're worried about the wolf in the henhouse effect. So if you were to partner with, let's say, a large vitamin retailer like a GNC or Vitamin Shop and say, you have carte blanche ability to market your products to our employees or our members, likely employees would be overprescribed vitamins. They'd be told they need everything. They'd have handfuls of pills. They'd be spending more tomorrow than they did yesterday. We drive the complete opposite direction, Logan. So we're the first, I think, vitamin company since the dawn of time that's saying, let's not try to expand consumer wallet share. Let's try to get a more efficient vitamin routine using data. So we actually reduce pill load and improve efficacy of vitamins by using that database assessment to craft more targeted, more potent products. They get consumers to less spend, less pills in the category. And employers love that as a value-based care play for their employee base.
Is there a role here in terms of education in talking about vitamins and the uptake in GLP-1s?
Absolutely. A vitamin routine has to be very complementary to a GLP-1 routine. So with GLP-1s, you have things like muscle loss. You might have decreased levels of focus and energy because you're so sapped from not intaking as much food as you previously did. And so nutritional supplementation could fill some of those gaps and actually bestow back some functional benefit for you. But you need to get vitamins in the right dosing, especially if you're on a very skewed diet because of GLP-1s. I think that's the biggest mistake is a lot of people will take a multivitamin they buy off the shelf, like an A to Z multivitamin, thinking there's a lot of things in here. This will probably solve everything I need. But the fact of the matter is those products are built as kitchen sink vitamins. They're built with everything, including things you don't need that are taking up space in the pill. And they're dosed according to the RDA scale, or daily value scale, which is oftentimes not the right scale to give you that functional benefit. The RDA scale was built for a healthy individual eating a balanced diet. What's the minimum nutrition necessary for that type of person to avoid nutritional deficiencies over time? So it's more of an insurance, if anything, for a healthy individual eating a balanced diet. It's not the type of nutritional dosing you would need to correct deficiencies or to get to evidence-based functional benefits from certain nutrients.
Now I'm going to get a little personal. Think about myself and vitamin usage. I'm 43. I am vitamin curious, and I would assume that I represent a portion of your target audience. I want to stay healthy. I've never taken vitamins, but I'm curious about, what you do and about vitamins and supplements. But my doctor has never recommended I take vitamins, and it's probably the barrier that I have. Talk to me about why that is, or like what would have to take place for physicians to become advocates of something like Vous Vitamin.
Yeah, I think many of us are aware that doctors get very limited education on nutrition in medical school. The saying is 5 minutes of nutrition in your medical school curriculum. And then after they graduate medical school and get into practice, very few of them stay up on developments in the nutritional supplementation space. It's just not their core focus area. And so many of them are undereducated, underinformed on some of the benefits of proper nutrition delivered through supplementation. But I think it was very telling during the COVID-19 pandemic. The chief medical officer really for the country was Dr. Anthony Fauci, who we saw day in and day out on TV as our national COVID czar, if you will. And Dr. Fauci was very open that he was taking vitamins as a preventative effort against COVID-19. He was taking vitamin D, zinc, and vitamin C. So when the nation's chief scientist is saying, I'm taking vitamins in the case of a respiratory illness, and this is what I'm taking, I think that's a pretty strong endorsement from the medical community that there is value to nutritional supplementation in that way. Our doctors have spent years kind of researching the space, and they think there's a lot of myths in the vitamin space that people that they need to debunk and haven't been debunked in the public. So myths like you just take handfuls of vitamins and it doesn't matter. There are real overdose effects. There's real medication interactions as well. Over 25,000 people hit the emergency departments every year with vitamin medication interactions. And so there is a need, especially through the employer space, to deliver better education on what's evidence-based, what's real in terms of the vitamin space, and that's what we're trying to accomplish.
You brought up Fauci, Dr. Fauci. How do you think the influences in the new administration could affect how people view vitamins and supplements and what might be covered in the future?
Well, the first two people that come to mind, obviously, are Robert F. Kennedy Jr. and Dr. Mehmet Oz, who are both big proponents of vitamin supplementation. I think there's mixed feelings about those two individuals because they're not always science-based in some of their recommendations. And so I've heard them called the vitamin industry's worst best friend in some case. those aren't necessarily the champions that some of us would desire. However, if they can make some policy change that lays the groundwork for true champions of evidence-based nutritional supplementation to make headway, then I'm all for, some of their actions that they may take, like bringing vitamins into an FSA, HSA coverage determination.
How would you like to see that formulated so that we kept the fox out of the hen house?
Yeah, I think companies have to be very careful who they partner with in the vitamin space. What you don't want is companies that will be pushing things like herbal supplements that might have very limited basis to them in terms of understanding, or areas that may not be helpful to many employees on a daily basis. I think collagen, sports nutrition has a lot of areas for abuse or inappropriate usage. I think they have to think about what's essential daily nutrition. How do we stay within the guardrails of essential daily nutrition? And how do we get an efficient solution for our employees that really saves them out-of-pocket dollars? Because today, most employees are shopping on their own. They only have the market buying power themselves. They're not part of groups when they're buying their vitamins. And they're walking into stores where there's so much markups built into their bottle. There's cost of shelf space and distribution and retail markups all put into that bottle. And wouldn't it be better just to have a direct-to-consumer subscription program where you avoid all those unnecessary costs and get something targeted to you delivered to your doorstep? Well, why are you paying for those types of overhead costs?
All right. Last question. Looking ahead at 2025, kind of where you're hoping to grow and what you're looking forward to, if the perfect person could listen to this conversation and call you up to partner and to grow with you, what would that sort of partnership look like?
I think it's the person that understands the impact that personalization is going to have across medicine and nutrition together, and wanting to work with a company that truly has a good ethos to it. So founded by doctors, built around education, focused on efficiency, a pill load and cost for the consumer, really a consumer-centric attitude, and using data to build solutions that don't exist in the mass market, because there is no data around the individual when they're shopping, pushing their cart around. And boy, if you could gather the right data points and build products that were more targeted to those data points, people would get a lot better results in the long term from their nutrition.
And just to be clear, this is something that I could literally get off of this podcast and I could go to your website and actively order right now, correct?
Absolutely. So 10-year plus track record of serving customers. We're really proud of our quality and safety track record. You go to vouvitamin.com, VOUS vitamin. So VOU is the French word for you. And so we definitely play off of that meaning in the way that we've named our company and what we're trying to do in personalization.
Well, Brad, I appreciate you taking the time with me. It's been really interesting to watch your journey. You're a company with a great track record and history. You wrote the book on this, and it's interesting to see the industry shifting. And 2025 could be a very interesting year for vitamins and supplements. And so we might have to come back and have another conversation a year from now.
Thanks for having me, Logan, and go out and get the right daily vitamin, VOU vitamin. Thank you for the time.
All right, take care. Be well.